Hello and welcome to Medical Moron. Today we are going to take that dog for a walk. How is that medically related? Well, I'll show you how in just a moment. Let's go on inside. Hi, audio kind of junked up a little bit here, so I'm going to teach my dog to get into his leash while I talk to you about a Nobel Prize winner from 1937. So it's a Hungarian man, had a theory about centropy. Basically it says that every living cell lives for one reason: to grow, to express itself fully. What you can be, you must be. So the difference between humans and everything else in nature is we have a choice. A tree doesn't grow halfway and decides it wants to stop. It continues to grow because it doesn't have a choice. It's designed that way. This is centropy for the tree. We as healers in the medical profession have the gift of assisting these creations, helping people to reach their full centropy. For the patients, it's the decision to reach your full potential, to continue on your road to health, to continue to live your potential. This leads to the hospital and to the OR. On this road, you'll go through a suffering. It's the grit you must endure to live your life of fulfillment. Today, I'll assist you through some terminology which can be frightening for some and may disrupt your centropy. Is this all the terminology we'll come across? Of course not. But I'm thinking, even the Karens can learn this simple language if they listen. As we go for a walk. Sound like a good plan, Ursus? What do you think? Huh? Good plan? All right, buddy. Let's go. That didn't get very far. I realized, hey, what's up? I forgot something very important. Ta-da! This here beautiful shirt. Given to me by my wife's sister. I love this. Of course, a lot of you people will recognize this as a soccer shirt, and that's what it is. And who is this team? Let you see if you can figure this one out. Okay, now we go for our walk, right, Ursus? Been waiting for a while, haven't you, buddy? Sorry. Okay, let's go. Come on, buddy. It's a beautiful day for a walk, that's for sure. Oh boy, okay. Oh, sprayed up here. So it's I don't know, it's about 85 degrees, I'd say. Beautiful day. Oh, got something happening here. There's something brewing. Oh, good. Just that. That's okay. I can live with that. Okay, so let's talk about things that you might hear in the OR. Turnover, room 7. Moving and turnover assistance, room 7. Okay, basically means a procedure has finished. You're probably next in line. So if you're going to room 7, if that's the room, if it's a neurological room or an ortho room, you're having that type of procedure, well, get ready because you'll probably be going in soon. Marking the patient, it's a good one. So there's a universal protocol. It says when the possibility, I don't want to say this, of more than one surgical location exists, which is almost all the time, the surgeon should mark the patient with their initials, designating the location. Designating the location of where the procedure is to be done. Okay, let's go. So as you enter the hospital, you have lab work done if it wasn't done already, any other additional chest x-rays or anything like this that needs to be done. That's called the prep room. In the prep room, or next to the prep room, usually around that space because it's an OR, there's a PACU or a post-anesthesia care unit. This is where you go post-surgery, post-anesthesia. So that's called the PACU, and then of course the OR. Now in the pre-op room, you may have MRI, CTs, you may hear words like that. Those are just generally x-rays. One's done, I think it's a CT is x-ray machine. The MRI is more radiographic type stuff. Then you have, what else? You have, well, things you might hear, lab works, WBC or platelet count or PRBCs. And these are just white blood cell count, platelet count, knowing how your clotting factors are. And there's different components to each of these. PRBC being packed red blood cells, is it ready for use? Things like that. You may also hear code blue. Code blue means quickly get to where you need to be, because this guy is turning blue, and get the paddles out. It's going to happen. You're going to shock this guy. That's a code blue. Code red would be fire. Code brown could happen. Yeah, basically means I need assistance. Somebody has lost their bowels, and this happens periodically in the OR. Not often, but it can happen. And it's anesthesia. You're given anesthesia. People keep control of their bowels because the bowels are paralyzed. They're not working or functioning during anesthesia. But as soon as the patient wakes up, so the bowels, and it can happen. What else can we talk about? Crash cart. Well, that's what runs the code blue. There's other codes. There's a gray, code orange. Gray would be security. Code orange might be some sort of a chemical spill. And it's different. Each hospital's got their own little spiel on these things. Timeout. Okay, this represents the last part of the universal protocol. It's performed in the operating room a lot. Outside the operating room, sometimes when you're doing lines and things like that. So immediately before the planned procedure's initiated, the timeout represents the final reassurance of accurate patient identity, sites, and procedure. And there's other things we mentioned in there. Is the prep dry? There's a wait time on things like this. Checking the armband. Hopefully, if the patient's awake, we do it with the patient awake, which is a good thing. Stuff like that. Raytech. It's a 4x4, a 4-inch piece of radiological gauze. We track these to make sure they are not left in the patient, along with lap sponges or sponges, which are just like a big dish rag. But they're all tracked. We do counts in the OR, make sure none of this is left in the patient. Of course, that's a bad thing. We don't want that to happen. So we'll do the counts. We count all surgical instruments. We count needles and caps and syringes and just about everything that you can imagine would be an OR table. We will count. Okay, dude, this is like your 5th time. Slow down on that stuff, okay? Oh, stuff like that. We count. Something else you might hear when you're inside the OR is please airplane the patient, which means tilt you or roll you from side to side. Do we have our Army Navies ready? That's a retractor that we use intra-procedure. It's called an Army Navy or USA. We've got a lot of different names of things that are kind of unusual. Kelly clamps are used often. Hey, this way, buddy. Mosquitoes, another little clamp. It's kind of getting smaller here as we talk. Many things in the OR that you're going to hear names. This one, there's impossible because there's thousands and thousands and thousands to name them all so that you understand this. Bear hugger, you'll hear that here. Oh, great. Damn it. That means I'll be using that black bag, which you've probably seen attached. Jeez. Oh my God, it's all over the leash. Right here. This we're not using. It's an electrical knife. It's used for cutting and cautery function. Separate tissue. That's what it's for. Come here. Christmas tree. Christmas tree is something anesthesiologists use. They use it to protect their tubes and cords from becoming tangled or compressed. So they hang it at the edge of the bed. They kind of stick it underneath the mattress, and they tag all their things onto it and keeps everything organized. It's a good thing. Donut, you might hear that mentioned in the OR. A donut is a support for the patient's head to help keep it in place, and it usually replaces the patient's pillow after anesthetic induction. Come on, nurse, let's go. Oh boy. Okay, let's get going here. It's been a long walk, dude. I know we kind of missed half of it on video, but it's okay. It's all right. So a drain is placed in many operative sites to prevent fluid accumulation. Okay, come here. Slow down. Slow down, okay, buddy? Irrigation. It's a turkey baster. Irrigation. So we have a bucket, little canister, graduated cylinder. It's got a measuring side on it. Then we have a turkey baster. Yeah, it's like a piece of equipment filled with normal saline that's used to irrigate, clean the operative site. Snow is a fluffy form of water that falls from the sky and provides great snowmobiling. But it's also used in surgery as a hemostatic agent. It's something that we sprinkle on. It's like, comes from the family of Surgicel. And yeah, the surgeon decides when he needs to use this stuff. It has additional clotting factors. That guy's got a never-ending bladder. A sponge, of course, we talked about this earlier, is to absorb blood. It's what it does. I'm hoping that this gave you a little bit more insight as to what happens in surgery that you might overhear. Not what happens, obviously it's not what happens, but what you might overhear in surgery as you're progressing through the stages from arrival to getting yourself actually into the OR. So I'm back home. We're gonna put this on this week, and I got a little bit extra homework to do. So I'm gonna pop this onto the YouTube, and well, we'll see where it goes from there. And next week we got something else new planned for you, so it should be pretty good. Okay, bye for now.